Breast health is very important for women. As such, a lot of women neglect their breast health. The reason being, either they are shy to go to doctors or they don't want to give a lot of importance to what happens to their breast. Now, as we know, breast being a very superficial organ, if you give little attention, any breast problems can be prevented and treated very well, and we can also prevent breast cancers. For this, we need to know what are the breast problems that can occur in the breast. Breast strain, breast nodules, breast lump, breast cyst, and discharge from the breast. These are the most common symptomatic problems women come to us with. So, this condition is called fibrocystic disease of the breast, or AND, aberration in normal development and involution of the breast. So, this happens because of mainly hormonal imbalance. How does hormonal imbalance affect the breast? So if there is a hormonal imbalance, let's say there is a fluctuation in the hormones on the breast, which can happen because of two reasons. One, which is very common, could be because of the nutritional deficiency. The other reason could be because of infections in the breast, which is also a common entity these days. And this can lead to what is called as fibrocystic disease of the breast, as I described before. Fibrocystic disease of the breast is one of the high risk factors for breast cancer. Apart from fibrocystic disease, there are many other high risk factors for breast cancer, like vitamin D deficiency, smoking, alcoholism, eating foods which can cause a lot of oxidants in the body. As a woman, you should know that during pregnancy, during lactation, you can get breast infections because all women have breast ducts with mild infection in the breast cells. And these infections in the breast can get activated anytime during pre-pregnancy or post-delivery during lactation. They can get infected and form a breast abscess, which is becoming very common these days. We are ending up draining these breast abscesses very often. So how do we prevent breast abscesses? One is keep yourself nutritionally very good, very important. Check vitamin D, B12 levels if possible during pregnancy itself. And post-delivery, a lot of times there is a tendency to avoid certain foods. Mothers will say don't eat curd, don't eat too much of oil. So there are certain foods that are needed, proteins and all kind of nutrition is needed for the mothers during even feeding and lactation time. So you have to give a lot of attention to your nutrition post-delivery, which can prevent breast abscess formation. What do we do to early detect the breast cancer if it is happening, or to prevent breast cancer? Most important is screening the women regularly. That is self-breast examination by the doctor once in a year, and if needed, scannings and mammograms whenever advised by the doctor. It is always better to do that because one, women will become more aware of their breast health, and you will also become more aware of incidence of breast cancer that can happen, which is increasing these days as compared to even cervical cancer. And you will also become aware of early breast cancers and pre-malignant conditions that could be present in your breast if needed, which can be tested with the further investigations. If we can detect at an early stage, then breast cancer is treated and it is curable, because